I very much enjoy meeting with you, Dr. Roz, and having a really great discussion, talking about the innovation and the experience you bring to this job is almost unprecedented. You're exactly the right person at the right time to take over this, this huge responsibility. I want to talk for a minute about Hyde. As you know, President Biden took several actions during his term to expand abortion access and travel for abortion using taxpayer dollars in many ways, including through the Medicaid program, which is explicitly in violation of the Hyde Amendment. Let me say it even more clearly, it's in violation of the law. If you're confirmed, will you commit to upholding the Hyde Amendment in ensuring that our federal health care programs are not providing abortions on the taxpayer's dime?
Senator Daines, I appreciate very much taking time with me. You're another original Maho person because you're able to haul that elk, I don't know how far, in the backlands of Montana. The answer is very simple, yes. The Hyde Amendment has been around for a long time, and CMS should obey the rule and fund accordingly.
Thanks, Dr. Roz. I want to talk about Medicare coverage for new technologies and innovation. During President Trump's first term, he spearheaded efforts to ensure that seniors could have access to innovative medical devices through the Medicare program. The Biden administration repealed these efforts and replaced them with the TSAT rule, which provided a pathway to expedited coverage for a limited number of innovative medical devices. However, the rule requires new clinical evidence for eligible devices, which can be duplicative for innovative technologies that have invested in robust clinical trials. The question is, would you consider addressing this limitation that the Biden administration placed, or create a coverage pathway for innovative devices with existing strong clinical data?
Senator, yes. I think we lose a major opportunity when we create ambiguity in how devices are not just created safely, but also marketed wisely. And so the gap between when the FDA says this is a good product that can save lives and when the American people, beneficiaries of Medicare or Medicaid programs within the states, are able to access those. And I'll use the Mitra clip as an example. The Mitra clip, just as a reminder, was the device, I wrote a patent on it early on, but it's a device that was created with smart engineers and eventually received CE mark, which is European approval for sales in 2008. It took 5 more years for the US FDA to approve the device. That would save lives, it turns out, with clinical trials proving this, and save money at the same time. But despite that fact, it took another 7 or 8 years for CMS to fund patients getting this device if they're dying in heart failure with a leaky valve. So we wasted a lot of money. We maybe lost some lives because of it, and all because we had a regulatory apparatus that was not transparent. I believe we can do better. And to your point, we should make it easier for industry to create life-saving tools by aligning when the FDA approves a product with when CMS begins to fund it for beneficiaries, because that's our job, to provide the best quality care to the American people who are on Medicare, Medicaid chip, and even the exchanges, and these tools should be used.
Appreciate your expertise in the area, Dr. Roz. I want to shift gears here and talk about Montana rural health. And yes, I did pack that elk out, and yes, that is a workout to pack an elk out when you quarter it and walk miles back to the pickup. I believe rural health is a key component of America's healthcare conversation. It's really important in my frontier home state of Montana. It's distance, it's weather, workforce shortages, service line erosions are just a few of the difficulties we face in Montana as they try to access health care. Given the challenges of rural health care, how could CMS support the expansion of telehealth services? And I recognize telehealth is not just one silver bullet, but it's an important tool in the overall tool chest to help us provide better access. What are your thoughts on ways we could ensure that health care can be more accessible to these rural populations?
Well, as you know, this House Congress has a responsibility to extend telehealth widely throughout the nation, as it was during COVID. I think part of the opportunity for telehealth is to link it to large institutions in those areas. So an institution, a big one, let's say in Salt Lake City, might be able to be a telehealth partner to a rural health clinic in Montana. So it's not just that they pick up the phone when you call. It's not someone in another country far away that's answering the cry for help. It's someone from an institution that knows your protocols. Maybe they've shared theirs. You have a simpatico, a relationship that goes beyond just what's on the streamed-in signal. And that is how we'll build telemedicine, telepsychiatry, which is for mental health services, vital in places like Montana, especially where we have many people who are suffering from undiagnosed mental health illnesses, and there's no place to go in a consistent fashion to get those therapies. It is a major focus of mine, and if confirmed, it's one of the areas I think we'll be able to make major inroads because there are no opponents to this.
Yeah. Dr. Ross, thank you.
Thank you.
Thank you. Senator Johnson.
Thank you, Mr. Chairman.